There are so many high-tech and invasive tests that are helpful for doctors to diagnose the stiffness of our blood vessels, a risk factor for arteriosclerotic heart disease and for strokes. And many of the carotid scanning tests can pose risks like the angiograms and CT dye contrast. We're going to talk about a simple, safe, effective, non-invasive, and inexpensive test that we'd like to see in mainstream medicine. Vascular stiffness test.
It's really hard to believe that this test isn't in the mainstream as a primary screening tool.
Maybe because it's just too cheap and too easy.
It doesn't make much money for doctors.
It can't hurt you.
You look at the technologies that are available, and they are stunning. We do all kinds of invasive tests that give us great information, but they're not always so necessary. In fact, the United States Preventive Services Task Force has analyzed a lot of these tests. And the simple things as screening tests are what we should be using.
Well, there's some other tests that are used too, like the ultrasound and the MRA, which is an MRI with contrast as well.
Right. So we're looking for the blocks that are in arteries and whether or not there's arteriosclerosis there that's significant by measuring stiffness. And now there's a test that's actually been around for a long time, but it was recently brought into the mainstream medical journals again. And what it does is it takes a pulse of a finger. It puts a little monitor on your finger, and the pulse wave is what you see. When the pulse wave has got nice sharp edges to it and isn't broad and flat, you know that you've got normal arteries that don't have blockages. But if it's delayed because the artery is stiff and it can't register these high peaks and valleys, then you know you've got a problem.
Some of the things that makes your arteries stiff are the cholesterol and the plaques that build up.
Well, inflammation is your big thing. I mean, once the plaques and the stiffness are there, we look at things like cholesterol and homocysteine and lipoprotein little a. We look at coagulation factors. There are many factors that put us at risk. Even iron studies put us at risk for developing arteriosclerosis. But this is a simple way to find out if it's there.
And the other thing that's good about it is it's preventative.
Well, it
so
can
you
be.
can start doing it at a young age if you think it runs in your family.
Sure. If it runs in your family, why not do a screen like that? You probably do it for about $100 in a lot of places. And you can do mass screenings at a very effective price. Then if there's an abnormality there, you can move on and do whatever test seems most appropriate. And it may even turn out that you want to do a coronary arteriogram, which is a very sophisticated hospital procedure that costs a lot of money and does have some downsides to it, but you wouldn't want to screen people with a test like that.
Well, also, there's a supplement that can be helpful for people that do have stiffness. So let's talk about what that is. You don't have to take a drug.
Well, there are actually a lot of supplements that can help prevent the inflammation that's there and to dilate arteries. L-arginine is the amino acid that many people in nutritional medicine are using because it dilates up arteries that are stiff if they're constricted. And that can do a lot to even reverse the disease in the opinion of many doctors who use it in their clinical practice.
So I think we should encourage vascular stiffness tests in mainstream medicine, especially for prevention.
Well, I think that's right. In our clinic, what we do is we add to it two other tests that we'll often use if we have any suspicion that somebody may have heart disease to start out with. The electrocardiogram, of course, everybody's doing, and it's okay to use too, but as a screening tool, it's not very useful. And in fact, the United States Preventive Services Task Force doesn't recommend it as a regular screening tool on people who don't have heart disease. But the two tests we're talking about here now, one is heart rate variability, which just measures the rhythm of the heart. And if it's very regular, like a metronome, you know that you've got real problems.
Well, you want it to be faster when you're exercising. You want it to be slower when you're resting or sleeping. That just sort of makes sense.
Yeah, but the variability, the rate is not the big issue. It's the variability. So if you've got a boom, boom, boom heart rate, not good. But if you've got a heart rate that changes as you breathe or as you change your thoughts, that would tell you a lot more about the health of your heart.
And then there's live blood cell analysis.
Right. And that's another test that looks at the thickness of blood. If your blood is particularly thick and you've got arteriosclerosis with plaques on top of it or just inflamed arteries, you'll see that if those platelets are sticking together and the red cells are sticking together and you see fibrin, which is what causes clot to form in high amounts, you know you've got a problem that's going to add to it. So the combination of vascular stiffness, heart rate variability, and live blood cell analysis for those people that you're suspicious to have heart disease is a wonderful armamentarium that will give you wonderful screening for people in this setting.